119. The title of today's lecture is Living Well with Heart Disease. (120) Researchers tell us that heart disease is a genetic condition, meaning that the chronic health condition becomes part of your life from now on. So since it's a genetic situation, it doesn't go away. But just because it's a genetic situation it doesn't go away does not mean we can't control it. So we figure out what to do in order to control it, put that into place, and start to do it. The program that's put in place is cardiac rehab. Cardiorespiratory fitness is at the center of the program in order to change cardiorespiratory risk factors. Behavior modification of no smoking, stress management, proper use of medications, and diet modification are put into place. The diet modification to control artery problems is going to decrease total fat, saturated fat, and cholesterol to address total cholesterol and LDL, sugar and alcohol for the triglycerides, sodium, the blood pressure, and we're going to put all that into place to start to control cardiac risk factors. The control of cardiac risk factors has a twofold purpose in cardiac rehab. One is to rehab from an event and/or a procedure. The other aspect of what cardiac rehab addresses is prevention, to reduce the personal risk of having a cardiac event causing further injury to the heart muscle and causing risk of heart failure or death. 121. How prevalent is heart disease? We know that 1 in 3 people in the United States has heart disease. 37% of all deaths are related to heart disease. 1 death every 34 seconds occurs in the United States. It's the number 1 diagnosis at hospital discharge. 122. The various types of heart disease include arrhythmias, structural, including valve disease or mechanical disease, coronary artery disease, and heart failure. 123. What is heart failure? Heart failure means that the muscle of the heart becomes weak and abnormal, or the lower chambers can't relax and fill with blood as they normally would. So less blood is pumped out from the heart to the organs and tissues in the body. The pressure against the heart increases and starts to damage the heart, decreasing the effective pumping ability of the heart. But it's important to point out that heart failure does not mean that your heart has stopped working. It just works less efficiently. 124. Causes of heart failure. Heart failure is preceded by hypertension 91% of the time. Coronary artery disease is the most common form of heart disease and the most common cause of heart failure. Myocardial infarction or heart attack. We know that within 6 years of a heart attack, 22% of men and 46% of women develop heart failure due to muscle damage. Congenital heart defect is one of the most common types of birth defect. Some of those lead to heart failure. Valvular heart failure is a narrowed valve opening that makes the heart work harder to pump blood and can cause heart failure. In severe cases of COPD, the condition can actually cause the development of right-sided heart failure. This occurs when low levels of oxygen due to COPD cause a rise in blood pressure and the arteries in the lungs, and that condition is called pulmonary hypertension. Ejection fraction. The ejection fraction is the value that describes how well your heart pumps with each beat. 126. What do the numbers mean when we measure ejection fraction? Recall that when we measure ejection fraction, we're looking at how much blood pumped out versus how much blood should be pumped out. A normal level is 50 to 70%. Below normal is considered 36 to 49%. Low, which may confirm the diagnosis of systolic heart failure, is 35 to 40%. Very low, which carries a risk of possible life-threatening irregular heart rhythms, is below 35%. 128. Diagnostic testing for heart failure in addition to the ejection fraction. Physical examination includes Valsalva maneuver to detect left ventricular function. That exam is going to also include an X-ray. EKG helps assess heart rate, heart rhythm, and the size of the ventricles, and the blood flow to the heart. A Holter may be worn to look at the heart performance and the heart condition. Heart cath is used to locate narrowed and blocked blood vessels. MRI is often used in diagnosing several conditions of heart disease. Nuclear scans are used to track blood flow and diagnose heart disease. 129. Blood testing that will help assist in diagnosing heart failure. CBC panel is a series of tests that measures red blood cells, white blood cells, and platelets. Also looks at sodium and potassium levels and measures to detect problems with electrolytes. Basic metabolism panel is a blood test that measures electrolytes, fluid balance, and kidney function, blood levels of urea, nitrogen or BUN, calcium, carbon dioxide, chloride, creatinine, glucose, potassium, and sodium. Liver function tests measure enzymes that your liver releases in response to damage or disease. The BNP test is a blood test that measures levels of the protein called BPN. That is made by your heart and blood vessels and elevates when you have heart failure. 130. Summary of the medications used to treat heart disease and heart failure. Cardiac glucosides increase the ability of the heart muscle to contract properly to prevent heart rhythm disturbances. ACE inhibitors, they're going to open up the blood vessels and decrease the workload of the heart. Diuretics help rid your body of fluid and sodium. Beta blockers reduce the oxygen requirement of the heart and also lowers blood pressure. Nitrates dilate the heart arteries. (132) Now that we've reported our symptoms, had a diagnosis, what kind of treatment in addition to the medications that we discussed is going to be included in the secondary prevention for patients with coronary vascular disease? We know that those are included in the risk factors. What specifically do we need to change on these risk factors to accomplish our goal? Those risk factors are smoking cessation, blood pressure control, lipid management, physical activity, weight management, diabetes management, medication management, and having a flu shot. (133) Smoking cessation goal. Our goal is complete cessation, no exposure to environmental tobacco smoke. Avoid secondhand smoke. Rehearse how you're going to avoid passive smoke in cars and restaurants. Ask about medication and nicotine patches if you have physical withdrawal or relapse. Remember, the risk of sudden death doubles if you return to smoking at any time, at any level. 50 to 70% lower risk within 5 years of quitting smoking. (134) Blood pressure goal. A normal blood pressure is less than 120/80. So know your blood pressure range Elevations in resting blood pressure increase the risk of cardiac events. For every 1 millimeter drop in resting blood pressure, there is a potential for a 2 to 3% drop in heart attack risk. (135) Lipid management of the LDL cholesterol. The goal to reach is below 70. Achieving LDL goals can reduce short-term risk of cardiac events by 40%. For every 1 millimeter rise in LDL above 100 results in a 2% increase in risk. 4% decrease in cardiac risk for every 1 millimeter rise in HDL. Triglycerides of below 150 reduce the risk of cardiac events. 136. The goal of cardiorespiratory or aerobic exercise is going to be a duration of 30 to 60 minutes of low to moderate exercise performed at a frequency of 5 to 7 days per week. Moderate exercise is measured and defined as a 3 to 6 minute range, the same as walking a 15 to 20 minute mile. Resistance training can be added to the program 2 days per week. Moderate exercise reduces overall mortality by 25 to 50%. 137. The goal to achieve on ideal body mass index is less than 25 for minimal health risk, 25 to 29 for moderate health risk, and 30 represents a high risk. Death rate increases from all causes with increased body mass index. Weight reduction can reduce cardiac risk by at least 25%. Abdominal obesity is strongly associated with heart disease and higher levels of cholesterol. 138. Diabetes management has a goal of an A1C level of less than equal to 7% with a glucose control average of 150. Diabetes increases the death rate from heart disease by 2 to 4 times. Exercise makes the body more receptive to insulin and reduces the risk of cardiac events. 141. The flu as a risk factor. The U.S. Center of Disease Control and Prevention recommends a flu vaccine to reduce mortality and flu complications. Studies have shown that the flu is associated with an increased risk of heart attack and stroke. A 2018 study found that the risk of heart attack was 6 times higher within a week of confirmed flu infections. (142) So in conclusion, we see that the modification of our cardiac risk factors by way of the structure of cardiac rehab, and recall that that includes a cardiorespiratory exercise program at the center of the program, proper use of medications, smoking cessation, stress management, diet modifications, monitoring your symptoms, reporting to your doctor, and applying that program as a lifetime commitment has been shown to be very effective in controlling all components of cardiovascular disease.